Well, already we're in February, and while we're only still a few days in, it's been a fun few days. And here we're to looking ahead, though, the fact that February, not just Valentine's Day, but also a time to focus on the heart. It's American Heart Month, after all, and we thought it'd be a good time to bring in Dr. Malia Haq to talk about heart disease and what we need to know, what we need to be reminded of. Dr. Haq, how are you today? Thanks for being with us.
I'm doing great. Thank you for having me. How are you?
I am well. Thank you for asking. Let's go ahead and dive right in. We hear that heart disease, of course, affects and unfortunately kills more Americans than any other disease out there. But it still seems one of those things that we people need reminded of. What are some of those things that you like to share with people when they're sitting in your office? It's a message you'd like to get across to our viewers today.
So I like to tell, my patients or all the viewers today to pay attention to, potential risk factors. Be aware of your health, your numbers, your blood pressure, your cholesterol, your diet, your activity levels, your stress levels, to just, be vigilant and aware, and know those risk factors so that you can prevent them from becoming a heart problem and lead to heart disease.
One thing that worries me as a woman, you always hear that risk factors and signs of heart disease can be different in women. What do women need to take note of?
Absolutely. So women can present very differently. While they do have, the traditional symptoms of chest pain, pressure, or tightness, compared to men, they're also more likely to experience completely different symptoms, such as shortness of breath, unusual or drastic fatigue, sweating, nausea, vomiting, abdominal pain, and indigestion type symptoms, neck or jaw pain. And so they may not recognize that these symptoms are heart related since they're so different from chest pain, and may seek medical care later, by the time which they have developed heart muscle damage. So that's the main thing to look for, is just any drastic change in your symptoms could be a warning of something going on with the heart.
Doctor, it seems like sometimes when we do get symptoms, especially in our busy lives, we tend to chalk them up to like, oh, it's not that bad. Or, in this case, maybe it's just indigestion, or maybe I just slept wrong and I have like a stiff jaw when you were talking about those with women. When do you go ahead and pick up the phone and make that appointment?
So I think when it gets to that point where you're having something new, that's a change, and you all of a sudden you can't walk the same amount without getting winded, or you start feeling like you're sweating more, or you start having this unusual pain, that's the time to call. When it gets to a point where it's staying constant and not coming and going, then that's even more worrisome. That's the time to call 911. That's, an immediate danger. But just anything that comes on suddenly that's new, the symptoms I just talked about, is a good time to, call your primary doctor and get in to see them, or a cardiologist.
And of course, whether or not the symptoms are there are always ways that we can improve our health. And in order to end this segment, I would like to be able to go ahead and share some of those that people can keep in mind to improve their heart health during this special month of attention.
So if we know our risk factors, outside of family history of heart disease and our age, if we know our risk factors, then we can control them to prevent, heart disease from becoming an issue. So watching our blood pressure, cholesterol, paying attention to diet, having more fruits and vegetables, whole grains, and avoiding processed foods, simple carbs, and things that are unhealthy, saturated fats, and so on and so forth. Quitting smoking or not starting if you don't smoke, avoiding secondhand smoke exposure, physical activity. At least 30 minutes of brisk walking a day can do you so much good. So that's very important. And then that goes in hand with maintaining a healthy weight. Reducing your stress levels, your emotional stress levels, very important also. It can cause, constriction of blood vessels and lead to other problems. So, I'd say those are the easy ways to maintain a healthy heart.
Well, of course, if you want more information, floridaheartexperts.com, or contact your doctor. Dr. Malia Haq, thank you so much for being with us today and sharing this important information.
You're so welcome. Thank you for having me.